First thing I want to say is I think there are a few common misconceptions. Children don't suffer from high blood pressure. If they do, there's always an underlying cause, congenital cause or genetic cause. They grow out of it. Even if they're hypertensive, they don't come to any harm because you see them running around, they're fine, and it doesn't really cost much for the health service. And we're going to try and move this on. Now, this is data taken from 2003. It's Scottish data, and it's just plotting prevalence of cardiovascular disease in Scotland. And you'll see already that there are groups, 16 to 24, who have cardiovascular disease. And there's a good reason for that. There are a marked number of strokes in children every year. Now, hypertension, when it presents in children, can often be really insidious. The effects can creep up on you and they can be catastrophic when they do occur. But that's for a small number. For the majority of kids, if they have high blood pressure, it just gradually develops. So in childhood, blood pressure normally increases with age and body size. So it's actually quite difficult to define normal blood pressure and high blood pressure. So we have to take into account a child's gender, their age, and their height. And that means you end up with some awful looking tables like this. You have to take into account age. You then have to plot their height on a percentile chart to get their height percentile. And then you have to measure their blood pressure and work out whether it's on the 90th centile, the 95th centile, 99th centile, or even higher. So this is not something that your GP or your normal doctor would do routinely because they get confused. Most pediatricians don't do it. And then we define high blood pressure in children as, well, normal would be less than the 90th centile for their sex, age, and height. And stage 1 hypertension would be 95th to the 99th centile, and stage 2 would be greater than the 99th centile for their sex, age, and height. So you've got a whole load of these tables, boys, girls, different ages. Now, what's the prevalence of hypertension in childhood? This is a study, this is a report from 2010. It looked at abnormal high blood pressure throughout the world. And as you can see, it tends to sit at about 10, 13, 14% of children in a variety of studies around the world have abnormally high blood pressure. Not necessarily hypertensive, but above that 95th centile. And you can see these ages here. These are young kids. These aren't, 20-year-olds. Data from the States, which is more specific, has looked at the occurrence of high blood pressure, and they've called it systolic hypertension, diastolic hypertension, or the pH is pre-hypertension. And again, they find that about 4.5% of their kids have systolic hypertension. And I think it's important to remember that systolic hypertension bit. They don't have diastolic hypertension, they have systolic hypertension. And systolic hypertension is something you would normally associate with the elderly population. Right, Tom? Okay, this is another study. This was published in about 2004. And what they did was they took about 5,000 children, they measured their blood pressure, and first time they measured it, they found that 90% of them were hypertensive. Second time they measured it, they found it's about 9.5%. And third time, about 4.5%. So all the studies, primarily from the States, but studies as well from the rest of the world, suggest that the prevalence is about 4.5% of children will have abnormally high blood pressure. Does it matter? Well, we don't know. Prevalence of prehypertension is about 10%. Prevalence of hypertension is about 4.5%. Does that matter? There are no studies with hard endpoints in children for obvious reasons. They have a long life expectancy and they're very difficult to start. But there is evidence that childhood hypertension does lead to adult hypertension, and you know yourselves that has a significant risk of morbidity, stroke, heart attack, and death. And it also leads to something called target organ damage. And if any of you have been to the doctors for high blood pressure, you'll know that we look for target organ damage in terms of, is your heart muscle thickened? Is the muscle in any of your blood vessels thickened? Are your kidneys working properly? Now, if anyone here can explain this graph to me, I'll be really grateful. It's actually tracking children's blood pressure with time as they get older. And what it's done is follow up years, and here we've got the correlation coefficient. That is the agreement between them having blood pressure as a child and blood pressure as an adult. And as you can see, the relationship is fairly linear, and it does tell us, possibly more clearly in this chart, in this graph, that childhood blood pressure correlates really well with adult blood pressure. Now, it's the same here as in the adult. In the adult, we can say that a population is at high risk of a stroke. But as a doctor, I can't put my finger and point at you and say, you're the one. I can just say, you're in a population that has a 30 or 40% chance of having a stroke in the next 10 years. Same is true for children. We can identify the population that are hypertensive, and we can say, you're in a population in whom 80% of you will get hypertension as an adult, but we can't point our finger and say it's going to be you and you're going to get significant hypertension. Now, does hypertension in children cause any damage? Well, we can't talk about strokes and we can't talk about heart attacks, although they do occur in children, but we can talk about markers of damage to the child that occur as a result of high blood pressure, and which, if they occur in an adult, we know are significant. And the common things we look for are things like a reduction in the glomerular filtration rate, the ability of the kidney to filter, whether the muscle has got bigger and thicker in the heart so that it can work against the high blood pressure, and also whether any of the walls of the major arteries are thickened as a response to the high blood pressure. So renal damage, GFR, hypertrophy of the left ventricle, left ventricular mass index or left ventricular hypertrophy, and thickening of the major blood vessels is known as Intima-media thickening. Now, this is a study from the States again. It's only 160 kids, but I just want you to look in this red box. LVMI, left ventricular hypertrophy. So this is thickness of the heart. And what they've done is looked at the normal blood pressure, and then stage 1 hypertension and stage 2 hypertension. And they show really a definite trend that left ventricular thickness increases as the blood pressure increases in children. These were 13 years old, average age. So definitely heart muscle thickens in children if they have higher blood pressure. This is a really complicated table, but I just want you to look at the bit in the red box again. This is looking at the thickness of the wall of the carotid artery. And again, what you see is it increases from controls with normal blood pressure into essential hypertensives. And that increase in thickness is significant. So if we saw these in adults, we would say you've got damage from your high blood pressure. We assume it's the same in children. This is a poor prognostic sign. This is a whole conglomeration of studies that were published in 2007. And again, what they show is that GFR, that's glomerular filtration rate, the ability of the kidneys to filter, the thickness of the heart muscle, and the thickness of the artery walls all increase with increasing blood pressure, especially with the systolic blood pressure in children. And this data is from the ambulatory blood pressure monitoring in children, which Tom was talking about earlier in adults. Now, the issue is we know and have known for 5-6 years that high blood pressure in children causes damage or causes harm. But what's really interesting is it's significantly underdiagnosed. This study was carried out in about 14,000 children. 3.5% were hypertensive after multiple readings. Only a quarter were aware that they had high blood pressure. Now, we would consider that to be a real failure in adults. And in the States, it's considered to be a real failure. But in children, we just say, well, you know, who cares? Why is it undiagnosed? Well, no one measures a child's blood pressure. If any of you have got children, when you last took to the GP, did they ever measure their blood pressure? No, of course they didn't. And the reason they didn't is it's not regarded as important. Plus, if you do measure it, what do you do with the reading? You have to convert it from height to age to 95% centile, and you've only got 7 minutes anyhow with the GP. American data suggests, where they're far more keen on doing these things because it's an item of charge, only about 5% of kids get their blood pressure measured. And in the UK, they'd say up to 9%. But do you know what that's about? That's about women going for the oral contraceptive to the GP and family planning clinics, starting from 15, where they're still regarded as children, upwards. They will automatically get their blood pressure measured. So more women do get their blood pressure measured at an earlier age. Now, what causes hypertension in children? Right. Usually, we regard hypertension in children as being secondary. That is, it's due to a specific abnormality that we can identify, possibly treat. In 10-year-olds, that's undoubtedly true. Secondary hypertension. A small number have primary hypertension, which is the type of hypertension that most adults will suffer from. When we go to the 10 to 16-year-olds, the proportion who get primary hypertension or essential hypertension goes up to about 35%. So there's suddenly a big jump in the number of kids that have primary hypertension as they get older. I'll show you this just to show that in newborn infants, if they have high blood pressure, there's always a reason. And in fact, from infants up to 6-year-old, there's always a reason. But when we go to 6 to 10-year-olds, primary hypertension becomes the third most common cause of high blood pressure. And in 10 to 18-year-olds, it is the most common cause for their high blood pressure. Why the increase in hypertension? Just like the adult, we know that central obesity is key in the development of high blood pressure in the adult. Same is true in the child. We know that diet has a major part to play as well in development of hypertension. Low sodium good, high sodium bad. That's a mixed salad, and that's bad. Kids think that is awful. My son would throw this away straight away. This is, Tom tells me, a Glasgow salad, and that's good. So we go for that one each time. But the Glasgow salad is high in salt and high in all those important nutrients that children want, but doctors think are appalling. Now, obesity data is really key to this. This is data from about 2006, 2007. It's from NHANES, I think. And what they've shown in the States is that the prevalence of obesity has risen rapidly and significantly, about 4% in 1963, up to about 18% 2006. And don't worry, I know the UK is always a bit slower than the US, but we are catching up really fast. And so is the rest of Europe. Italy's got a major issue right now with this. And this increase in obesity mimics the increase in the prevalence of high blood pressure in children. The two curves are superimposable. We know that as the BMI increases, and I should say BMI is not a good measure for children. You don't want to use BMI because they're all different heights and weights for the same age. We use something slightly different from BMI, but as BMI increases, blood pressure increases. So, direct relationship. And we know that relationship, as we heard earlier, goes on into adulthood. So, prevalence of hypertension among obese children is estimated to be about 11%. And children with hypertension are 2.5 times more likely to become adults with hypertension. So this is a real issue. If we look at the risk factors for hypertension in children, it is being male, and don't worry, you don't lose that. So all the males here, you be aware that you're more likely, is that correct, Tom? Certainly you're more likely as male to die from cardiovascular disease just because you are male, but also obesity is a key factor in the development of hypertension. The other worrying factor, are there any paediatricians here? If not, the other worrying factor is that we are now seeing not just high blood pressure in our paediatric population, but we see diabetes, adult onset diabetes, not type 1 diabetes insulin dependent, type 2 diabetes, 6-year-olds, 7-year-olds. We see them with hyperlipidemias, hypercholesterolemia, and we see them with metabolic syndrome. These are all things that you think of in the kind of middle-aged, oil executive who drinks too much, eats too much, smokes too much, etc. Not in children under 15. So this is a real issue. And of course, the States are still ahead of us, but we're doing our best to catch up. Is it different from the adult form of hypertension? Right. I mentioned earlier they get isolated systolic hypertension. Isolated systolic hypertension is a type of hypertension we used to think was predominantly old women in their 60s, 70s, old men. These kids get isolated systolic hypertension. Most common form. And that is also bizarre. So they're getting diseases of older individuals. What does a childhood hypertension cost? Well, you can't say in the UK because no one's looking at it, but I can give you some figures from the States, which are quite interesting. We know the Americans have a very bizarre health service system. I would even go to say as far as to say it's probably the least cost-effective system in the world for the whole public. But this reflects the cost of an admission and discharge of a child from an American hospital. They're averaged throughout the whole of the States. $10,000 for the average kid. Kid with hypertension, $35,000. That was 1997. 2006, and that's the latest data they have, the cost is $52,000, $53,000 per admission and discharge for a child with hypertension compared to $15,000. If I think about the children I see with high blood pressure, if they went privately to a UK hospital, I would guess that their treatment bill would come to about $12,000 equivalent, about £8,000 if you look at all the investigations we have to do in children to rule out causes other than just obesity. The total cost in the States right now is $3 billion annually just for treatment of hypertension in children. We have no idea what it is in UK, and it's probably very low because you generally won't see children being screened, identified, or put on any kind of treatment. So, summary, childhood hypertension is common. These figures are from the States, but it's going to be the same over here. It does precede adult hypertension with all the risk that that carries. And you heard about lifetime risk, I think, from Sandosh. Is that correct? Lifetime risk means that you start off with a low risk when you're young, and it gets bigger and bigger and bigger. And what we do currently is we intervene when you've either had an event or we think you're coming close to one. There is a move to bring that treatment threshold down and start treating earlier, or at least intervening earlier. We don't want to medicalize everyone. It does cause end organ damage in children. It is most commonly due to obesity and high salt, high carbohydrate intake. And certainly in the States and North America, it costs lots of money. And I would guess that it's probably going to cost lots of money here as well. So that's all I have to say.